Hi everyone, welcome to week 7 of your Pharmacology 2 course. This week we are covering 2 chapters. The first chapter we are covering is chapter 21, and then we're also going to be covering chapter 22. Chapter 21 is all about anti-infective drugs, and typically when people think of an anti-infective, they think of antibiotics, but not all drugs that fall into this category are antibiotics. A good number of them are, but not all of them. So the first thing we're going to be looking at is what's the difference? Why is there different categories? And so the first example is the sulfa drugs. So these are a group of drugs that actually inhibit bacterial growth. They don't kill bacteria, they just keep them from replicating. And so that's why they're not called antibiotics, they're called sulfonamides. So anything that falls into this category is a sulfonamide. In other words, they don't kill the bacteria. So you're going to see these used for otitis media, ear infections, drugs like Bactrim and Septra. Those are the ones that typically fall into this category. So there's just an example. Those are combination drugs. Here's an example of what that label might look like. So what this is telling you is that it has 800 milligrams of sulfamethoxazole and 160 milligrams of trimethoprim. So that's a combination sulfa drug that is combined with an antibiotic that's used for, in this case, a ear infection. So then the next category that you're going to look at are those antibiotics. So these actually kill bacteria. The difference between the sulfa drugs and the antibiotics is one does not kill, they just inhibit the growth. So with antibiotics, these are actually going to kill bacteria. So penicillins fall into this category. A lot of folks do have allergies to penicillins. But these are just some of the drugs that are in that group of penicillins. Anything that ends in "cillin", you can usually take a pretty good guess that it is a penicillin-based drug. Then we have other groups like augmentin, which is amoxicillin, or amoxicillin, I should say. We've got Timentin, we've got Zosyn, Unison. These are all combination drugs, so they have a penicillin in them along with something else. Um, and then they're going to talk to you a little bit about how we discovered this category of drugs and how they became used frequently. They talk a little bit about when this happened, who was the first person that was actually injected with penicillin. So a lot of historical information when we talk about the antibiotics. And then we have another group of antibiotics, the cephalosporins. So these are the Keflexes and those types of things fall into this group of antibiotics. So the cephalosporins. And then let me just kind of scroll down here just a moment and I will get to, okay, then the aminoglycosides. These are like the gentamicins, the neomycins. You may have heard of those used fairly frequently. Again, all of these are part of the antibiotics because they are killing the bacteria. Then we have another group in the antibiotics, which is the tetracyclines. So there's several different tetracyclines. So anything ending in cycline is typically going to fall into that tetracycline group. Another great way to start to try to remember some of those drugs. And then we have a few others that are kind of not as common. The quinolones, the fluoroquinolones. Cipro is a really good example. That one might be one you might be fairly familiar with. And then when we get into a couple other smaller categories, the macrolides and the ketolides. So you'll see things like, oh gosh, I'm just trying to think off the top of my head, like azithromycin, Zithromax is one that you may see. And then we've got some combination antibiotic drugs. So Bactrim and Septra, like we said before, was a good example of a combination drug. And then we're going to look at some of the other types of drugs that fall into the anti-infectives. So we'll look at the drugs that are used to treat HIV and AIDS, because again, this is not the antibiotics and the sulfonamides are going to treat things that are caused by bacteria. anything that's treated or that is caused by a virus, we're going to use something else. So the drugs that are used to treat HIV and AIDS are antiviral drugs. So they're going to talk in depth about the history behind those HIV drugs, as well as how the drug therapy has changed over the years. And then we're going to look at other antivirals and what they are used for. So antivirals are not just for HIV and AIDS. They are for other types of viruses as well can be treated with antivirals. Nope, excuse me. Um, so let me see here. Let me find that slide for you. Just one moment here. Okay. So anything that's like influenza, hepatitis, those can also be treated with an antiviral type drug. So Tamiflu is a really good example of that. And then you can look at some of the vaccines that are used to treat or to prevent, I should say, viral infections. Then you're going to look at some fungal and yeast infections and what those can be treated with. And that's pretty much the extent of Chapter 21. Chapter 22 is going to be covering chemotherapy drugs. So we're going to look at a lot of different things dealing with chemotherapy. And really the key here in understanding the type of drug for chemotherapy is understanding a couple different things. What is causing, or where it's located, I should say, what type it is, and what stage it's in. So that's going to have a big effect on how we treat patients with chemotherapy drugs. That category of drug is typically known as an anti-neoplastic. So as you go through this week and these two chapters, if you have any problems or questions, please make sure that you reach out to me and have a great week.